Can you point to me where you feel the pain at?
Normally it's like around my sacrum.
We have some hip pain as well.
Yeah, normally this.
On the left
and it'll
side.
crack.
Anything else going on?
My neck.
There you go.
That was really good. Like less pressure.
Less pressure?
In my head.
There it is.
Hey, yo.
Before we get started, I know your lower back.
Yeah.
That's the biggest area, correct?
Yes.
Can you point to me where you feel the pain at?
Normally it's like around my sacrum.
Okay, so right at the bottom.
Yeah.
Okay, and I understand that we have some hip pain as well.
Yeah, normally this.
On the left
and it'll
side.
Crack.
It will pop.
Yeah.
Okay. Is it just kind of moving it and all of a sudden you hear a big old clunk, or like?
Yeah, like if I sit down, usually the first time in the morning, it'll
Uh-huh.
crack. And I'm like, oh.
Yeah, okay.
Doesn't sound right.
Any pain in the leg?
Sometimes, yeah, like tiredness.
Okay, so you feel like kind of like a tired
The
fatigue.
whole, yeah.
Any pain in the groin area?
Yeah.
Okay, so that can be very common. So especially looking at your x-rays, the way that it looks like on the x-ray that it's misaligned, oftentimes that does present with hip pain and groin pain. Now, I want to do a little bit of further investigating to figure out what's going on, but already looking at your x-rays, we can see things are not where they're supposed to be.
Out of
Okay.
balance, for sure.
Yeah, so your lower back, that's a big deal. Anything else going on?
My neck.
The neck,
Yeah, normally right here.
right at the base of the neck.
Yeah.
Okay. How long has the lower back been going on for?
I would say like 4 years.
Okay,
Yeah.
some time. Anything happened 4 years ago?
I actually, when I was at work, I work in the bakery, so
Okay.
I was putting a cake in the cold case.
Okay.
And I came up and I hit the top
Oh.
pretty hard.
Yeah.
And ever since then, I'm pretty sure.
That's where your neck started.
Yeah.
So did the neck start before the lower back or the lower back before the neck?
I'm not sure.
Okay, it's been some time.
Yeah.
Okay. Well, let's figure out what's going on. Let's see how things are doing. Do you get any headaches at all?
Yeah.
Okay.
Like tension headaches. When
Okay.
I lay down on my pillow.
Okay. Do you wake up with headaches?
No.
Not too often.
No.
Good. So it's usually towards the
End of the night.
on the end of the night or so when you're going down to sleep.
Yeah.
Yeah, a lot of times when we start to see headaches that kind of occur during the afternoon, towards the evening, usually those are what we would consider like more like tension headaches.
Yeah.
And a lot of that stems from either the mid to lower part of your neck or even the upper back as well. So I want to push into specific spots in your spine.
Okay.
If there's any pain, soreness, tenderness, let me know right away. Okay. Yeah, don't let me just keep pushing in there if you're suffering from some of the discomfort here, okay? So right up over here, so this is the upper joint, middle, and then the bottom one down here. Any pain on those?
No.
Not too bad.
Not too
I'm gonna go ahead and take a look at the motion of the joint here. So when these joints kind of get out of position, they will not move the way they're supposed to. When your pelvis, so it looks like on the pelvis, it says ASIN. IN stands for when the pelvis actually internally rotates and it's actually shifting inwards. Many times when I push onto the spine, you won't feel any tenderness because the tenderness is oftentimes opening up in the front of the joint, and that's more of the groin pain that you might experience. And so that is very common and very characteristic of that listing. So you can see it's not moving very well, but when that actually occurs, if it has been there for 4 years, oftentimes that starts the right side to start becoming hypermobile, and you'll start to notice that tenderness on the opposite side.
Yeah, like compensating.
Yes, exactly. It's going to be compensating. Let me take a look at this upper neck here. Good. So where you're going to see some of this stress, I'm looking for the motion of that neck here. This is your C7. 1, 2, 1, 7. Any tenderness or soreness there?
Yeah.
2. So I was going to say 2 is not moving the way it's supposed to. Would you say that's where you feel the most? Yeah. This is where we're going to see your hip is in trouble. Okay. So AS7, IN11. 11 degrees of rotation here is quite a bit. Okay. So your pelvis is really twisting and it's moving in this way. Now the sacrum and the ilium, basically what happens is when the ilium rotates internally, the joint opens on the front. So that will lead to a lot of that groin pain that people experience. It will also commonly cause hip pain on that side as well. And so when I push onto your pelvis back here, you may not feel any tenderness because the swelling is actually on the inside. But because of that, when it internally rotates here, the opposite side will rotate outwards. And that opens the joint on the back, and that's where you can feel that tenderness. And so we're gonna work on this one, and over time we'll start to see that this one will start to resolve as well, okay? So we're gonna work on this pelvis here. We also have T11 here. There is some trouble where your spine kind of shifts to that left side, and then it compensates to try to get you back into the center. So we're gonna work on this guy here, and then you'll see it kind of shifts back out here, and then right about here is where it kind of really comes back this way. So we're gonna work on your T2, we're gonna do your T11, and then your left hip. We will eventually have to work on this one down here, but this is the one that's kind of screaming at me to help out with what's going on in the neck here. Okay, sound good?
Yes.
All right, so let's go ahead and grab there. Face from this way for me. So I'm bringing this leg up just a little bit. And then from here, I'm gonna give this a little bit of a push here, okay? Relax in there. There you go.
Wow. I'm like, oh, finally.
Let's have a seat.
It was good.
All right, let's have you walk on that real quick. Go head over this way. We're gonna head back towards Dalton, and then we're gonna get you on this table. So come on over this way.
How'd that feel?
It was good.
One more time back over here. All right, so we're gonna go down here. This is gonna be your T11. Let's go ahead and get that kind of corrected, and then we'll come back up on top, okay? 1, 2, 3, 4,
Do you
5,
still have my hands on this, or
9,
can I
10,
drop?
11. You can drop them down to the floor, get your shoulders relaxed. There you go, that's perfect. Right on over here. You're gonna take a deep breath. Let it out all the way. Whew, that's really tight in there. All right, one more time. Let it go. Relax in the shoulder here. There you go, good job. All right, and then we got that T2. Let it out, drop the shoulders. Nicely done, good job.
That was really good. Like less pressure
Less pressure?
in my head.
So the work started in the practice, right? We got some movement in the joints, but if you were to go home and not get any movement, you're just sitting at home, then that doesn't do you any benefit, right? So now that we got movement in the joints, your job is to allow for more motion outside the office. And that's where the real work begins. So once we get the correction on the joint, now your body's doing the work to undo the years and years of compensation and stress, right? So walking every single day, 15 to 30 minutes a day would be super helpful because we want that joint to start moving better, okay? The other thing that's gonna happen is that you need movement for the health of the spine. And so as you move, it's gonna push out some of the inflammation and some of the toxins building up in the disc. It's gonna push that out. But it will also allow for more nutrients to get pulled into the disc so it can continue to heal, okay? So walking is super important.
Thank you.
Okay, good. All right, well, you're all set for today.